The SA AIDS conference has opened with a series of discussions aimed at improving the treatment of the disease. South Africa has the largest anti-retroviral drugs program in the world. Life expectancy has jumped by nearly 10 years since the program was rolled out. But scientists say there are still problems in making sure that everyone is taking their drugs. At the same time, it appears more people are still being infected by the disease. Anele Yawa is the Secretary General of the Treatment Action Campaign, a group which has been campaigning for better treatment for those living with HIV for almost 2 decades. He's with us now from Durban. Anele, good evening to you. Thank you for your time tonight. As South Africans, we, I think, justly celebrate our ARV program, but people are still contracting HIV. Where do we need to concentrate now?
Good evening to you and the viewers at home. I think as TAC and other progressive forces, what we want is access to treatment for everybody living with HIV and AIDS. However, there are some barriers within the system of the public health where we notice that many people living with HIV and AIDS, one, are experiencing shortage of medicines. In some instances, there are medicine stockouts where people will go to clinics and be turned away because certain ARV medicines are not available. And in some instances, people are switched from these medicines to other medicines without them being prepared. And as the result of that, some of the people are experiencing complications. But also, we're still having a healthcare system, a public healthcare system that is broken, which is failing the same people that is meant to serve. In South Africa, we've got a population of about 57 million people, and about 42 million of those people are public healthcare users. But when we look at the healthcare workforce, both in private and public, we've got less than 300,000 doctors and nurses. So the question we must ask ourselves as the country, how do we expect a health workforce of less than 300,000 to be able to provide quality healthcare services to a population of about 42 million? Why is our government freezing these posts? Why we don't hire nurses, hire doctors? But also when you get inside the facility, you experience that because of the nurses are overworked and are overburdened. In many instances, because of this, they tend to vent their anger to the users, and as the result of that, some of the people, they don't feel comfortable to go to the same clinic where they were shouted at. But in some instances, you find out that there are some of the nurses and the healthcare workers who are disclosing the status of people living with HIV and AIDS without their consent, and this makes some people not to feel comfortable to go back to this facility. So these are some of the things that we want to put on top of the table, is to say, here is a platform, let's discuss about these issues, both as government, as civil society, and everybody. We're still having a problem in the country of teenage pregnancy. The question we're asking, when are we making contraceptives available so that young girls can be able to prevent themselves from falling pregnant? But also, we've got this program which is called PrEP. One of the things that we are putting on the table is to say, when are we rolling out the PrEP program within the public healthcare institution, so that if a young person goes to a clinic and wants to access PrEP services, those people are able to access PrEP services within our public healthcare institution. So there is a package of issues that we would love them to be addressed by this Congress, this conference.
And then, you talk about all of that. This country has probably gone on one of the biggest campaigns in history in terms of changing behavior. Condoms are available in schools. Something unimaginable 20 or 30 years ago. Why do you think that the problems of teenage pregnancy are still with us? Why do you think that people are still, needlessly and unnecessarily telling, to broadcasting someone's status when they know it's the wrong thing to do? Do you think we just still need to do more work in this area?
Yes, we still need to do more work. One of the things the problem we have in the country, we've got a challenge of HIV new infections amongst young girls aged 14 to 25. And we must ask ourselves, where do we get these young girls during the week most of the times? Most of the times they are in schools. We do have a policy around sex and sexual education, but the problem is we don't implement it. So we strongly believe that within our institutions of learning, both at high schools and in tertiary institutions, we need to have programs that speaks about sex and sexuality so that young people can be able to make informed decisions in terms of prevention, in terms of services, and how can one make sure that we take safety precautions in order for one not to be infected by HIV and AIDS. But also, we are still living in a society that discriminates, a society that judges people based on their HIV status, and yet in that process, some of these people who are discriminating people living with HIV and AIDS, some of them, they don't even know their HIV status. That's why we are encouraging the public to say, here are our clinics, let's go and know our status so that if you are found to be HIV positive, you can be initiated on ARV treatment early, and if you are an HIV negative, you can be advised how to remain a negative. So this is a problem of a society, and this problem needs the approach of the society so that we can all work together and make sure that we don't again experience situations of people like the late Gugu Dlamini, who was stoned to death by her community because of disclosing her HIV status. But we
Anele,
still
I'm sorry,
issues
I've let you speak for
our society.
Anele, I've let you speak for a very long time, so I'm going to interrupt you there. I do want to ask you one last question. The scientists and some of the research that I've seen today suggest that one of the problems is that that the people who take anti-retroviral drugs, some of them are not taking them at the right time. And I realize that this is a behavioral issue. I realize it's a difficult thing in some communities to make sure that you take the same pill at the same time every day. There are also issues around food and availability of food. But do we need to go on yet another campaign to tell people how important anti-retroviral drugs are?
Yes, we have that responsibility of going out to our communities, encourage them to adhere to their treatment, because immediately when you stop taking your treatment and you stop and take it again, chances of one developing resistance are very high. But also the system needs to take blame, as to say, when medicines are not available for people at facility level, it is the system that denies people access to medicines. Yet, on the other hand, they talk about adherence. In order for one to adhere on treatment, we need to make medicines available, and we need to encourage people to adhere to their treatment.
Anele Yawa, thank you very much indeed. The Secretary General of the Treatment Action Campaign, speaking to you on the line from Durban.